Welcome to Pigeon Healthy. What I'm about to share with you could save your pigeon's life tonight. I'm not exaggerating. These are 5 specific signs that indicate a pigeon is in critical condition and may die within the next 24 to 48 hours if you don't act immediately. I've seen these signs hundreds of times over years of keeping pigeons, and I've learned that when you spot them, you have a very narrow window to intervene. Miss that window and you lose the bird. Act quickly and correctly, and you can often pull them back from the edge. Before we begin, I need to be very clear about something. If your bird is showing any of these signs, you're dealing with an emergency. Natural remedies have their place, and we talk about them extensively on this channel. But when a bird is this sick, you need to act fast and decisively. That might mean emergency veterinary care, it might mean pharmaceutical intervention, and it absolutely means immediate supportive care. Don't waste time searching for the perfect natural solution when your bird is dying. Save the bird first, then work on long-term natural health. With that said, let's go through the 5 signs. Sign number 1 is the posture of death, and once you learn to recognize it, it's unmistakable. A pigeon in critical condition sits in a very specific way. The bird is on the ground or the lowest perch, unable or unwilling to move to a higher position. The feathers are completely fluffed, not just slightly puffed, but fully expanded, making the bird look much larger than normal. This fluffing is the bird's attempt to maintain body temperature because its metabolism is failing. The head is tucked back into the feathers, often turned backwards and buried in the back or under the wing. The eyes are partially or fully closed. The bird is motionless except for labored breathing. The feet may be tucked up under the body, or if the bird is very weak, it may be sitting with its keel bone touching the ground, unable to hold itself up properly. This posture tells you the bird is in shock, severely hypothermic, or both. Shock can result from blood loss, severe infection, toxicity, or extreme pain. Hypothermia happens when the bird's metabolism has slowed so much it can't generate adequate body heat. Either way, this posture means the bird is shutting down. Without intervention, death will follow within hours. What to do immediately? The first priority is warmth. A bird in this condition cannot maintain its body temperature. You need to provide external heat. If you have a heating pad, set it on low, wrap it in a towel so it's not directly touching the bird, and place the bird on it. If you don't have a heating pad, use a hot water bottle wrapped in cloth, or even a plastic bottle filled with warm water. The goal is gentle, consistent warmth, not intense heat that could shock the system further. Place the bird in a small, confined space, like a cardboard box or small carrier lined with soft towels. The confined space helps retain heat. Keep the bird in a quiet, dim area away from stress and disturbance. The second priority is hydration. A bird this sick is almost certainly dehydrated, and dehydration accelerates death. You need to get fluids into the bird, but you must be very careful. A bird that's semi-conscious or has its head tucked back cannot swallow properly. If you try to give water by mouth forcefully, you'll cause aspiration, where fluid goes into the lungs instead of the crop, and that will kill the bird even faster. So here's what you do. Mix up an emergency electrolyte solution using 1 liter of lukewarm water, 1 tablespoon of sugar or honey for quick energy, 1/4 teaspoon of salt for electrolytes, and 1/8 teaspoon of baking soda to help buffer acid buildup in the system. Mix thoroughly until dissolved. Take a dropper or small syringe without a needle. Draw up the solution. Gently pick up the bird and support its body. Very carefully open the beak just slightly. Place 1 single drop of the solution on the inside of the beak near the back of the tongue. Wait and watch. The bird should swallow reflexively. If it does, wait 10 seconds and give another drop. If it doesn't swallow or if fluid is coming back out of the beak or nostrils, stop immediately. The bird is too weak to swallow and you risk aspiration. In that case, you can only provide heat and get to a veterinarian who can administer subcutaneous or intravenous fluids. If the bird is swallowing, give drops slowly and patiently. Your goal for the first hour is to get about 5 to 10 milliliters into the bird, which is roughly 1 to 2 teaspoons. That doesn't sound like much, but for a bird this compromised, it's significant. Over the next several hours, if the bird is improving and swallowing well, you can increase to giving 1 milliliter every hour. The third priority is determining the cause if possible and addressing it. A bird doesn't reach this critical state for no reason. Common causes include severe infection where bacteria or other pathogens have overwhelmed the system, poisoning from toxic substances, predator attack or injury with blood loss and shock, severe parasitic loads such as extreme worm burden or coccidiosis, organ failure from chronic disease, and extreme stress or hypothermia from environmental exposure. Look for clues. Is there injury, blood, or obvious wounds? Is there severe diarrhea suggesting infection or parasites? Are other birds sick, suggesting infectious disease? Was the bird exposed to any potential toxins? If you can identify the cause, you can begin to address it, but understand that a bird in this condition needs professional help. If there's any way to get emergency veterinary care, do it. Call ahead, explain the situation, and get the bird there as quickly as possible while keeping it warm during transport. Sign number 2 is respiratory failure, and this is terrifying to watch. Normal breathing in a pigeon is quiet and subtle. You barely notice the chest movement. Respiratory failure is the opposite. The bird is breathing with its beak open constantly, not just occasionally open but unable to close its beak between breaths. The chest is heaving with each breath, with exaggerated movement that you can see from across the room. The bird may be making distress sounds, gasping, wheezing, or clicking noises with each breath. The neck may be extended forward as the bird struggles to get air. The bird may be standing rather than sitting because lying down makes breathing even harder. In severe cases, you may see the tail bobbing up and down in rhythm with breathing, which indicates extreme respiratory distress. This sign tells you the bird cannot get adequate oxygen. This could be from severe respiratory infection, where the lungs and air sacs are filled with fluid or mucus, aspergillosis, where fungal growth is blocking airways, air sac rupture or pneumothorax, where air has escaped into the body cavity, severe anemia, where there aren't enough red blood cells to carry oxygen, heart failure or airway obstruction from a foreign body, or severe swelling. What to do immediately? First, remain calm. Your panic will stress the bird further and make breathing even harder. Place the bird in a quiet, dimly lit space where it can rest without disturbance. Stress increases oxygen demand, so minimizing stress is critical. Provide the best possible air quality. If you're indoors, open windows for fresh air but avoid cold drafts directly on the bird. If the air is dry, increase humidity by using a humidifier or placing bowls of water nearby. Humid air is often easier to breathe than dry air. Do not attempt to give anything by mouth to a bird in respiratory distress. The risk of aspiration is extremely high. Anything that goes down the wrong way will worsen the crisis. If you have oxygen available, supplemental oxygen can be life-saving. Place the bird in a small carrier or box and direct oxygen flow into the space, but ensure adequate ventilation so carbon dioxide doesn't build up. Without oxygen equipment, the best you can do is provide optimal air quality and reduce stress and oxygen demand. For respiratory infections, if you have access to it, nebulization with saline can help loosen mucus. A nebulizer creates a fine mist that the bird breathes in. Plain sterile saline works, or you can add a small amount of respiratory herbs like thyme or eucalyptus to the saline. Though be very cautious with essential oils as they can be overwhelming to a bird already struggling to breathe. 10 to 15 minutes of nebulization every few hours can provide some relief while you arrange veterinary care. This bird needs a veterinarian immediately. Respiratory failure is not something you treat at home with herbs. The bird needs diagnostic imaging to determine the cause, possibly oxygen therapy, likely injectable antibiotics or antifungals, and potentially drainage of fluid from air sacs. Call ahead to an avian veterinarian, explain the respiratory distress, and get there as fast as safely possible. Sign number 3 is neurological signs, and these indicate that something is affecting the brain or nervous system, which is always serious. Neurological signs include head tilting, where the head is held at an abnormal angle to one side, and the bird cannot straighten it, circling, where the bird walks in tight circles, unable to move in a straight line, loss of balance, where the bird cannot stand properly and keeps falling over, seizures, which may appear as convulsions, wings flapping uncontrollably, or the bird falling and thrashing, paralysis of wings or legs, where the bird cannot move one or both limbs, stargazing, where the head is twisted upwards or backwards in a fixed position, and blindness or inability to track movement with the eyes. These signs indicate possible causes including Newcastle disease or paramyxovirus, serious viral infections affecting the nervous system, head trauma from flying into objects or being attacked, toxicity from heavy metals like lead or zinc, or from other toxins, brain infection or abscess, stroke or other vascular event, severe vitamin deficiency, particularly vitamin B1 or thiamine deficiency, and inner ear infection affecting balance. What to do immediately? Place the bird in a small padded enclosure where it cannot hurt itself further. A bird with neurological problems may thrash, fall, or injure itself trying to move. Pad the container with soft towels. Remove perches and anything hard the bird could hit. Keep the environment quiet, dim, and calm. Neurological issues are worsened by stress and stimulation. If the bird is having active seizures, do not restrain it or try to hold it. This can cause injury. Just ensure it's in a safe padded space and let the seizure pass. Most seizures stop within a minute or two. After a seizure, the bird will be disoriented and exhausted. Keep it calm and quiet. For head tilting or balance issues, offer food and water in shallow dishes on the floor where the bird can access them without needing to balance well. A bird that cannot balance may not be able to reach elevated feeders or drinkers. Monitor carefully to ensure the bird is actually eating and drinking. Birds with neurological problems may forget how to eat or may have difficulty coordinating the movements. Certain nutritional supports may help depending on the cause. If you suspect vitamin B deficiency, which can cause neurological signs, a vitamin B complex supplement for birds can be given. Crush a B complex tablet and mix a tiny amount into water or give directly by mouth if the bird can swallow. If you suspect toxicity, activated charcoal can help bind toxins in the gut. Mix activated charcoal powder with water to create a slurry and give 1/4 teaspoon by mouth if the bird can swallow safely. However, neurological signs require veterinary diagnosis. Many causes need specific treatment. Paramyxovirus has no cure, but supportive care improves survival. Head trauma may need anti-inflammatory medication. Infections need antibiotics. Toxicity needs identification of the toxin and specific antidotes. Do not delay veterinary care, hoping the bird will improve on its own. Neurological damage can become permanent if not treated promptly. Sign number 4 is the green staining, and when you see this, you know the bird has not eaten in a dangerous length of time. Normal pigeon droppings consist of a formed fecal portion that's brownish or greenish-brown, topped with white urates. When a bird stops eating, the droppings change. The fecal portion becomes liquid and bright green. This green color is pure bile. The liver produces bile continuously to aid digestion, but if there's no food moving through the digestive tract, the bile is excreted alone, creating these characteristic bright green liquid droppings. Additionally, you may see green staining around the vent where these droppings have soiled the feathers. In severe cases, the bird may even vomit green bile, which stains the feathers around the beak and chest. This green staining tells you the bird has not eaten in at least 12 to 24 hours, possibly longer. A pigeon's metabolism is fast, and they need to eat regularly. Going without food for even a day is serious. Beyond 2 days without food, the bird is in critical danger of organ failure. The cause might be that the bird is too weak or sick to eat. There's an obstruction preventing eating, such as canker lesions in the throat. There's severe pain making eating unbearable, or the bird is so stressed or depressed it has given up. Whatever the cause, the green staining is a red flag that demands immediate intervention. What to do immediately? You need to get nutrition into this bird as quickly as possible. The ideal is a commercial hand-feeding formula designed for birds. These formulas are balanced and easily digestible. Mix the formula according to package directions with warm water until it's the consistency of thin pudding. Draw it up into a feeding syringe. If you don't have commercial formula, you can make an emergency formula. Take cooked rice or oatmeal, blend it with water until smooth and thin enough to pass through a syringe. Add a tiny bit of sugar or honey for quick energy, and optionally add a small amount of protein like blended cooked egg. This isn't nutritionally complete, but it's better than nothing in an emergency. Feeding a bird that hasn't eaten in days must be done carefully. The crop and digestive system have shut down and need to be restarted gently. For the first feeding, give only 2 to 3 milliliters of formula. Slowly insert the syringe into the side of the beak, aiming toward the back of the throat and slightly to the bird's right side. This directs the formula into the crop opening. Depress the plunger slowly, allowing the bird to swallow naturally. Watch the crop area on the right side of the chest. You should see it filling slightly. After the first small feeding, wait 2 hours and check the crop. Gently feel it. If the crop is empty or nearly empty, the formula has passed through and you can give another small feeding. If the crop is still full, wait longer. A crop that isn't emptying suggests the digestive system is not functioning, which is a serious problem requiring veterinary attention. Assuming the crop is emptying, give small feedings every 2 to 3 hours throughout the day, gradually increasing the amount as the bird tolerates it. Monitor the droppings. As the bird begins digesting food, the droppings should transition from pure green bile to containing some actual fecal matter. This may take 6 to 12 hours. The bird's energy and alertness should improve within a day if you're getting adequate nutrition in. Sign number 5 is the hypothermia, and this is often overlooked until it's too late. A healthy pigeon maintains a body temperature around 40 to 42 degrees Celsius. When body temperature drops even a few degrees, metabolic processes slow down. Drop much further and the bird enters a hypothermic crisis where organs begin to fail. You can often assess body temperature by touch. Pick up the bird and hold it against your body. A healthy bird feels warm, noticeably warmer than your own skin. A hypothermic bird feels cool or even cold to the touch. Check the feet specifically. In a healthy bird, the feet are warm. In a hypothermic bird, the feet are cold. The feet may also appear pale or even bluish instead of the normal pink color, indicating poor circulation. Check under the wings. Place your hand under the bird's wing against its body. This area should be very warm. If it's cool, the bird is hypothermic. Behavioral signs of hypothermia include extreme lethargy, where the bird is barely responsive, fluffed feathers as the bird attempts to retain any heat it has, shivering, which may be visible as slight trembling, though in severe hypothermia the bird may be too weak to shiver, and the bird seeking heat sources, trying to get close to lights or heat or pressing against other birds. Hypothermia can result from environmental exposure if the bird is wet, in cold conditions, or in a drafty area, from illness where the metabolism has slowed due to infection or organ failure, from starvation where there's no fuel to generate heat, and from shock or blood loss. What to do immediately? Provide external heat sources as quickly as possible. Use a heating pad on low setting. Wrapped in a towel, a heat lamp positioned so the bird can move closer or farther as needed, hot water bottles wrapped in cloth placed around but not directly touching the bird, or even your own body heat by holding the bird inside your shirt against your skin. Get the bird into a small enclosed space that will retain heat like a box or carrier lined with towels. Monitor the bird closely as it warms. Warming should be gradual. Rapid warming can shock the system. You want the bird's temperature to increase slowly over 30 minutes to an hour, not instantly. As the bird warms and becomes more alert, offer the electrolyte solution we discussed earlier. Warm the solution to body temperature before giving it. Cold fluids will drop the core temperature again. Give small amounts frequently. Once the bird is warm, responsive, and hydrated, offer food. A bird recovering from hypothermia needs easily digestible, energy-dense food. Soaked seeds, hand-feeding formula, or even cooked egg are good options. After you've addressed these immediate life-threatening signs, the next question is always, why did this happen, and how do I prevent it from happening again? A bird doesn't reach critical condition randomly. There's always an underlying cause. Common scenarios include a bird that seemed fine yesterday is dying today because of acute poisoning from ingesting something toxic, sudden severe infection that overwhelmed the system, or an injury that went unnoticed until shock set in. A bird that's been sick for a while but you didn't realize how bad it was because illness in birds is often hidden until it's severe. Birds are prey animals and instinctively hide weakness. By the time they can't hide it anymore, they're often critically ill. A bird that's been in poor conditions with inadequate food, water, warmth, or shelter finally reached the point where its body gave up. Or a bird with chronic illness like organ disease or cancer that has been slowly declining and finally reached the crisis point. In any case, once you've stabilized the bird and it's out of immediate danger, you need to investigate why this happened and address the root cause, or it will happen again. But in the moment when you see these 5 signs, your only job is to act fast. Warmth, fluids, quiet, and veterinary care. Those are your priorities. Everything else can wait. I've saved birds that look dead using exactly these principles. I've also lost birds when I hesitated or didn't recognize the signs early enough. That's why I'm sharing this with you today. If you found this video valuable, please share it with other pigeon keepers. This information genuinely saves lives. Leave a comment below if you have questions or if you've dealt with a critical situation and want to share your experience. And subscribe to Pigeon Healthy for more practical, potentially life-saving information. Thank you for watching, and I hope you never need to use this information. But if you do, now you know what to do.